Recently, I was looking at studies for Fisetin, which is an anti-aging supplement. It's also a naturally occurring flavonoid in a lot of fruits and vegetables like strawberries, persimmons, apples, but it occurs at a lower dosing amount. And so that's why people are looking at, using it as a supplement at higher doses for anti-aging because it can be seen as a senolytic, so it kills off senescent cells that contribute to aging and inflammation. Those types of cells can accumulate, and that could be things like arthritis, but even stroke or neurological disorders potentially could help with that. And so the studies are mostly in vitro and animal studies, and they are promising, but there's very few human studies, but there are a lot of ongoing human studies. So hopefully we'll get the results in a few years. And a lot of them are about arthritis or neurological conditions, but potentially it could help with that. Now, the dosing they looked at, and it's important that you talk with your primary care provider because at too high of a dose, it can kill normal cells. So obviously, we don't want that. You don't want to kill off normal cells, only the ones, the senescent ones that could potentially be causing problems. But the dosing I saw in the studies was anywhere from 100 to 500 milligrams per day, or they were doing a pulse dosing of taking it only 1 or 2 days a month every month, but at a higher dose of 20 milligrams per kilogram. So it was a weight-based dosing based on your weight. And so that's why I definitely look at it with your primary care provider to make sure that you're taking it correctly if you are thinking about taking it, because there are side effects of if it's too high dosing, it could kill normal cells. But hopefully, the animal and in vitro studies are promising, so hopefully it would have, beneficial effects in humans as well.